and the hip and the anatomy of that. We're going to start off right here with the anatomical leg length, okay? So you're going to think of length, how long something's going to be, anatomical, anatomy, the body. They're already giving you a location. It's going to be the leg. Measured from the medial malleoli and the anterior superior iliac spine. So off the bat, you're going to have to think of the length of the leg. Where are you measuring from? You're going to measure from the medial malleoli and the anterior superior iliac. ACEs, yeah, it's going to be labeled under ACEs. I'm always going to think of ANA equals ACEs. So if I'm reading and I see anterior superior iliac spine, I'm going to think of ACEs. I pair those two together. That's the one how I remember that. We're going to jump right here to, I'm not skipping. I'm just trying to get through this for you right here. Well, I am skipping, but I'm just going to try to go more the ones I had trouble understanding. Myositis ossificans traumatica. This one I always remembered as MOT. For some reason, it was really weird. I started reading the definition. It's going to be an abnormal formation of cartilage or bone and a muscle that may be caused by improper care of a thigh contusion, leading to incomplete absorption of hematoma. It comes with a lot, and it's like you're reading it and it's like, wow, like this is a lot. Off the bat, itis, inflammation. I'm gonna write ossi, bones. Traumatica, trauma. So then we go right here. Off the bat, they're gonna give you bones. Bone, muscle. Maybe causing proper care. Thigh contusion. Thigh contusion. That's big. They're gonna give you the word contusion. Contusion's just another word for trauma. That's how I'm gonna remember that one right there. And then it's just giving you bone, it's giving you muscle, it's giving you thigh contusion. It's already giving you what these mean. You just have to, know these meanings right here, especially the bones, because it's giving you in it. We're gonna jump back down here to Patrick Faber test. I always remember the Faber. Because Patrick test, I don't know, Faber always stuck to me. Assesses pathological conditions of the hip and sacroiliac joint. Off the bat, this is just really one that I really had to remember. For some reason, with pathological, I always remembered Patrick. Pat and path. Pat equals path. That was my mnemonic for those. And then conditions of the hip and when it gives you assesses, I always think of a test, because a test is always going to be an assessment of what you know. So to me, it's going to be a test equals assessment, and pathological I'm going to match with Patrick, because that's just how I remember it for short. So off the bat, I'm reading a habit, and then the rest of it's going to just tell you where the location is at. We're going to jump right here, talking about what do the Kendall and Thomas test determines the extent of. It's just asking you what these two tests are going to be, what it's showing you. It's going to show you flexion contractures. Okay, for some reason, tract and test, for some reason in my head, it really comes together. And if you remember the Kendall and Thomas test, you're going to remember how they run it. And you're going to remember, what it's determining, or what it's making sure, or checking for you. You're always going to think of flexion contractures. But to me, tract and test, I'm going to put it together. And flexion, I'm always going to remember with Kendall and Thomas. We're going to jump right here. I'm going to skip this one. I'm going to go to this one because this one was actually one of my favorites. It's going to ask, what is the main muscle that allows to rise up from a seated position? If you're sitting down and you get up, where are you going to feel it? In your butt, right? That's your gluteus maximus. People don't say butt, but they say gluteus maximus, makes it sound really cool because that's actually the technical name. So right here off the bat, if you don't know one of these, it's really gonna have to be one you're just gonna have to remember. But to me, seated position, what are you gonna use the most? You're gonna use your gluteus maximus, and it allows you to get up, because without that, you're just gonna be stuck in your seat. We're gonna be right here jumping down to what should be avoided when treating a hamstring strain. Stretching with ballistic movements. This is so important. When people get a hamstring strain, this is how I remember, because at athletic training, one thing kids would always do, get hamstring strains. Every single football player would come to us and be like, oh, my hamstring hurts, my hamstring hurts. all of a sudden they start doing all these ballistic movements. And we'd be like, why are you doing that? Like, that's just gonna aggravate your hamstrings more. You know, we can show you certain stretches. I always used to remember Chavez yelling at all the kids, and that's how I remember this one. Because kids with hamstring strains think they should do certain movements that are gonna help them, and you know, it ends up hurting them in the long run. So that's how I remembered this one, stretching with ballistic movements. We're actually gonna skip these right here. We have a whole list right here that has to do with shoulder and elbow. Right here, the shoulder and elbow, okay? We're gonna start with acceleration. This is already gonna make you think of somebody that's running. To me, they're gonna start, and they're gonna start excelling and excelling. They're gonna try to go faster and faster. So it starts at maximal external rotation until the ball is released. So if you have a baseball player, okay, they're gonna start at maximal external rotation, and until the ball is released. So they're gonna start up and they're gonna excel, and they're gonna wait till the ball's released, and that's gonna be your part of your acceleration phase. You're gonna jump right here to the cocking phase. That's gonna start when the hands separate and end when maximal external rotation is achieved. They're saying, oh, maximal external rotation, you know, it just means they're gonna be finishing with their swing. They're just using some fancy words. When you think of cocking, you're gonna think of somebody that's constantly jerking. In my head, and it's going to be when the hands separate. That's when they're going to start constantly jerking, and they're going to jerk, and that's when they're going to reach maximum external rotation is achieved, and has to do with cocking. Then we're going to jump right here to deceleration. It's going to start from ball release and exclude external rotators of the rotator cuff. You're going to remember that, external rotators of the rotator cuff. Contracting eccentrically, gotta know what that means, until the shoulder reaches maximum internal rotation. Very fancy words. All it's saying is that it's winding down. It's starting to wind down. All this stuff happened, and it's reaching maximal external rotation. So now it's winding down. Okay, so I'm gonna try to go through this a little faster. We're gonna go through the follow through right here. It's gonna start with maximal internal rotation and end when the athlete is in a balanced position. Their follow through. So when you're looking at kids and you're looking at their follow through, it's gonna start somewhere. It's gonna start at maximal internal rotation. That's where it's gonna start, and it's gonna end when the athlete is finally back in their base position and they're balanced. That's their follow through right there. So I remember balanced position and maximal internal rotation. That's what I'm gonna think of. I'm always match that with follow and through, because balanced position, you're through with it. We're gonna drop right here down to rotator cuff. I don't remember that's at. Supraspinatus, infraspinatus, teres minor, subscapularis. So for me, for some reason, I think of sits. Well, actually not. It's actually labeled under sits. And cuff. Okay, so I think of a policeman's handcuffs right here. He has a handcuff, and what are they going to do when they cuff what's it called? Oh, man, wow, I'm just forgetting right here. So what are they going to do when they cuff the bad guys? They're going to put them in the cop car, they're going to sit. So for me, whenever I see rotate or cuff, just solemnly like this, you know, there's nothing else to it, I'm always going to think of cuff, and I'm going to think of sits. And it's going to have to deal with everything right here. So from there on, I just actually had to remember what each thing stood for, or I can just look if it labels under sits right here. That's how I remember that one. We're going to jump right here to what is the most common direction for the shoulder to displace? Anteriorly. This is just one I really actually had to remember. There's actually not much to it. I don't actually tie anything. I just have to remember direction. I always think of common direction, and people are always gonna have their common direction under anterior, and you just really gotta remember this one. That's really what I use for this one. If I'm gonna use a mnemonic, I'm gonna think of common direction, and the common direction people are gonna label things under is anterior. Even though it's talking about the shoulder to displace, to me, common direction for people to use is anterior. We're going to jump right here to the second page. Okay, we're going to jump right here to the wind-up preparation phase. Sometimes I'll get these two in the cocking phase mixed up. one thing that really helps me differentiate is it starts with the first movement until the ball leaves the gloved opposite hand. So once it starts with the first movement till the ball leaves. So once you grab that ball and you pull it back, you're already starting the wind up phase. You're already preparing. Okay, so I always think of ball leaves and then glove. I always think of like the ball leaving the glove and then they're preparing. Just like when a pitcher has its the ball and it's looking and they're staring straight directly at the batter. They're preparing to throw the ball. So that's the way I really remember that one. I'm going to finish the annotations for this one, and I will send you a picture of the annotations. This, again, has to do for the quiz with the hip, thigh, shoulder, and elbow. So that was that one for those. Thank you.